Welcome back, viewers. Today's topic is on prostate cancer and the fifth part of the cancer series. With an estimated almost 1.4 million new cases and 375,000 deaths worldwide, prostate cancer is the second most frequent cancer and the fifth leading cause of cancer death among men in 2020. Incident rates are threefold higher in transitioned than in transitioning countries. Whereas mortality rates are less variable, it is the most frequently diagnosed cancer in men in 112 countries out of 185 countries of the world. What is cancer? I have filmed a video to explain this in detail. I recommend you to watch that. The link is in the description. The prostate is a part of the male reproductive system and is located just below the bladder and in front of the rectum. It is about the size of a walnut and surrounds the urethra. The urethra is the tube that empties urine from the bladder. It produces fluid that makes up a part of semen. As a man ages, the prostate tends to increase in size. This can cause the urethra to narrow and decrease the urine flow. This is called benign prostate hyperplasia, and it is not the same as prostate cancer. The main marker of prostate problems is prostate-specific antigen, as a short is called PSA, blood test that is used to screen for prostate cancer. But PSA level is also high in BPH patients. If a man has difficulty starting urination, weak or interrupted flow of urine, urination often, especially at night, trouble emptying the bladder completely, pain or burning during urination, blood in the urine or semen, pain in the back, hips or pelvis that doesn't go away, painful ejaculation, they need to see their GP for further investigation. But keep in mind that these symptoms may be caused by conditions other than prostate cancer. There are several tests to find out if the symptoms are benign or due to prostate cancer. The number one is physical examination. A doctor or nurse can perform the examination to determine the size and shape of prostate. If they find any abnormalities, they can refer the patient for further tests. In an MRI scan, a specialist gives score to the result of MRI scan that looks like cancer. Then the next test is biopsy, in which a tiny sample of the prostate tissue is taken for further investigation in the lab whether cancer cells are present. In case cancer cells are present in the biopsy, CT scan is recommended to examine if the cancer has spread outside the prostate into the surrounding organs. A bone scan also is performed in case the cancer has spread into the bones of the patient. All men are at risk for prostate cancer, and the most common risk factor is age. The older a man is, the greater the chance of getting prostate cancer. Some men are at increased risk for prostate cancer. Men from African ethnic group or those who have a family history of prostate cancer. Exposure to certain chemicals increase the risk of cancer. If you are interested to know more about harmful chemicals that can cause cancer, I have filmed a video on the subject. You can watch that by clicking the link in the description. A team of doctors and other professionals recommend the best treatment and care for the patient. If the doctor thinks that prostate cancer is unlikely to grow quickly, they may recommend not treating the cancer right away. Instead, choose to wait and see, either by carrying out regular tests and examination, or second option is to treat any symptoms when they develop. A prostatectomy is an operation where doctor removes the prostate. Radical prostatectomy removes the prostate as well as the surrounding tissue. Radiotherapy is the radiation used to destroy the cancer cells, whereas cryotherapy is placing a special probe inside or near the prostate cancer to freeze and kill the cancer cells. Biological therapies works with the body's immune system to help it fight cancer or to control side effects from other cancer treatments. Side effects are how our body reacts to drugs or other treatments. Then high intensity focused ultrasound directs high energy sound waves or ultrasound waves at the cancer to kill cancer cells. Chemotherapy is used to shrink or kill the cancer using special drugs. The drugs can be pills you take or medicines given through your veins, or it can be a combination of both. And hormone therapy blocks cancer cells from getting the hormone they need to grow. 1 in 6 UK males will be diagnosed with prostate cancer in their lifetime, whereas 13 out of 100 American men will get prostate cancer during their lifetime, and about 2 to 3 men will die from prostate cancer. Prevention is better than the cure. There is also strong evidence that regular exercise can lower the risk of developing all types of cancer. If you want to know more about duration and recommended exercise type, please watch my video on exercise. The link is in the description. This concludes the 5th part of the cancer series. I recommend you to watch the rest of the episode on this series, which cover the history of cancer, chemicals responsible in cancer development, and most common types of cancers globally. If you found this video informative, you can share with your family and friends and subscribe to this channel for more informative content. Thanks for watching.